Bangladesh missed its last measles vaccine drive. Now, dozens of children are dying. The vaccination rate below 60% is blamed for measles outbreak in Bangladesh. A measles outbreak in Bangladesh has led to 15 confirmed deaths, officials said on Wednesday, as the government readies to launch an emergency immunization program as part of efforts to try to contain the disease. Health Services Division Secretary Kamruzaman Chowdhury said the deaths were confirmed after laboratory testing of 33 samples, conducted with support from the World Health Organization. Of the tested samples, 15 deaths have been directly linked to measles infection, he said. Measles, among the most infectious of pathogens, requires that 95% of the population be vaccinated in order to prevent its spread. It has been breaking out across the world as vaccination rates have fallen, although now many parents are rushing to get their children immunized, and in some places, pediatric hospital wards are overwhelmed. In Bangladesh, the government plans to launch an emergency nationwide immunization drive from Sunday, beginning with high-risk areas. The outbreak has hit hardest in the northwestern Rajshahi region, where health authorities have stepped up surveillance and case tracking. The Directorate General of Health Services said unvaccinated children or those who have not completed the 2-dose measles schedule face the greatest risk, and that malnourished children are particularly prone to severe complications such as pneumonia and encephalitis. They have urged parents to keep children's routine vaccinations up to date and to seek medical care quickly if symptoms such as fever, cough, red eyes or a rash appear. Shahir Sajjad, director of the expanded program on immunization, told the Daily Star that special vaccination campaigns are carried out every 4 years. Besides, the regular vaccination program was disrupted at least 3 times last year due to strikes by health assistants who administer vaccinations in rural areas, he said. A funding crunch following the suspension of the sector program that finances vaccination efforts also disrupted services. The vaccination rate, which included measles, declined to 86.6% in 2024, Prothar Mallo reported, citing the government's expanded program on immunization. Last year, it dropped significantly to 59.6%. Based on reports from early 2026, Bangladesh is experiencing a significant measles outbreak with at least 15 to over 50 child deaths reported, largely attributed to a sharp decline in vaccine coverage and failures in the procurement of expanded program on immunization, EPI, vaccines during the interim government's tenure. Following the political, social, and administrative changes in Bangladesh in August 2024, the interim government's handling of the vaccination program has been heavily criticized. Key aspects of the failed vaccination situation, 2025-2026, vaccine procurement delays. A Prothar Mallo report points to bureaucratic delays and indecision within the health ministry during the interim government's tenure, which caused stock shortages. Suspension of programs. Reports indicate that decisions to halt certain health sector programs in late 2024, intended to reform the system, disrupted the vaccine supply chain and caused a breakdown in routine EPI activities. Dropped coverage. Measles vaccine coverage in 2025 reportedly dropped to 57.1 to 59.6%, the lowest in 8 years, far below the 95% required for herd immunity. Missing campaign. A planned 2024 measles vaccination campaign was not executed, and subsequent delays prevented an emergency drive from taking place in early 2026. Shortage of supplies. Despite the arrival of some vaccines, it was reported that syringes were missing, further delaying the immunization campaigns. As of late March and early April 2026, the government has begun taking emergency measures, including lowering the vaccination age to 6 months and launching a nationwide campaign, while the health minister has stated that the surge is due to the previous lack of a vaccination campaign. However, critics and health experts have blamed the neglect and delay in the procurement process for this crisis.